today on the show, we've got Dr. Morresey Schnobrich, and she's going to talk about on-farm dystocias.
Excited about this one because at Rood Riddle, Morresey is one of the true characters. Incredibly well loved by staff and especially by her clients, but a character. She's a lot of fun.
Yeah. Morresey's a little bit of a live wire, and this on-farm dystocia talk, it could be a little bit heavy duty, but I'm looking forward to her injecting a little bit of life into it and her talking at her usual 1,000 words a minute.
Yeah, it's a scary time for a horse owner, to have a mare deliver, and so this is a good topic and a timely one now.
Yeah, I agree totally. I mean, we get a little bit sort of desensitized to it, I think, in the hospital because we see all of these problems, but when you're actually out in the field and actually faced with it and you've got limited resources, limited personnel and limited facilities, it's going to be really good to actually hear her take on how you actually manage these things at the coalface.
Right. A lot of times you're out there by yourself.
Yep.
You and a mare.
Yep. And everybody needs friends, Bart.
That's right. That's right. Well, I'm ready to talk to Morresey. You ready to bring her in?
Absolutely. Looking forward to it. She's going to improve the average look in this room.
That goes without saying.
You got it.
Why the podcast? Rood Riddle Veterinary Pharmacy has a relatively small marketing budget, especially when you compare us with our competitors. I understand that marketing is important, but telling people that you exist and what you do and why your products or services are different is a must. I thought about what makes us unique, and I realized I wanted to give people something of real value. And that's how the podcast idea evolved. I wanted to use the money we had set aside for marketing, not to tell people who we are, but rather to show them, to open up how we do things and give something of value at the same time. The content of this podcast is designed to do exactly that. It's not going to serve as a shameless plug for pharmacy products or services. We want you to know who we are, that quality is uncompromised, that we care about people and their animals. If there are specific topics that you would like us to cover or guests that you would like to hear from, please email us at StallSide@rrvp.com. Hope you enjoy the show. Just one more note, nothing that we talk about here today should be construed as veterinary advice. That's why you have a relationship with your own veterinarian. Thank you for listening.
Welcome to StallSide. Today we're actually going to be talking to Dr. Morresey Schnobrich, who's on our Theriogenology service here at Rood Riddle. Morresey, welcome to the show.
Thank you. I'm
Welcome,
excited
Morresey.
to be here. Thanks, guys.
Good to have you.
Yep.
Okay, so before we get underway, tell us a little bit about yourself. Tell us the story of Morresey.
Oh, boy. Okay, well, I've been at Rood Riddle since I graduated vet school. I'm from Boston originally, and
Some people think I'm from Boston as well.
forget about it.
Yeah, that's right, because I go and park my car and they
Pack
start
your
to ask
car.
which town in Massachusetts I'm from.
I can pick up a Boston accent pretty quick. I miss it. But yeah, so I grew up in Boston and went to Penn for vet school, then came down and worked with Dr. Riddle in 2008. Stayed here 2 years, and then I did a theriogenology residency up at Penn and came back. So I've pretty much worked in Pennsylvania and Kentucky, and we live here, 3 kids, 1 husband. Everything's good.
Okay. So when you're not making babies, what do you like to do with your time?
All things reproduction.
All
here with
things
Morresey Schnobrich.
reproduction.
You knew that was coming. You knew it was coming.
Yeah, I was pregnant during my residency. That was a good joke. You're asking me what I don't even, I got lost. Making babies distracted me.
Well, it obviously did at least 3 times.
Yeah, right. I also turn red when I'm embarrassed, which we're going to catch on camera. Okay.
Yeah, that's right.
So yeah.
but tell me, besides veterinary medicine, what are you interested in?
Okay. Definitely spending time with friends and family is huge. And then I actually used to be a mural artist. So if I get time, which is very rare, away from kids, family, other obligations, I do try to do some art.
Really?
Yeah, but
I didn't know that about
yeah,
you.
I did inner city murals. I was actually, before I went to college, that's what I was going to do.
So you're the one that was tagging the sides of those buildings
Yeah.
in Philadelphia.
Yeah, we're not going to
Union Pacific?
ixnay on the graffiti. No, I'm just kidding. But yeah, no, I that was in college. I did a bunch of kind of like youth program murals where there would be underprivileged kids, and you pick an area and you paint. I loved it.
Did you have
awesome.
photographs of any of that?
Yeah.
Okay, we need those. Okay.
Yeah. That was my other life.
Okay.
And then I decided I had to do something more concrete, like equine reproduction.
I can see the direct line between
Right,
murals
direct.
and reproduction. But I think you're holding out on us a little bit. Tell us about the chickens.
Oh my goodness, yes. Okay, so I have to say that as somebody who likes to watch things, reproduce. Horses making babies, that the generation time in chickens is really appealing to me. So I have probably 80 chickens right now, and they're amazing. I love them. I have like fluffy ones. We have one named Mitch who kind of runs the show. I can't really afford too many racehorses right now, so we're starting with chickens, slowly getting into horses, and the losses are less painful with chickens.
So chicken jockey, the career of the new millennium.
Exactly.
Okay, so let's talk about something serious, although this is going to be difficult. So tell me, you're out there, how common is dystocia?
Okay, so usually the numbers that people will talk about for the instances of horses having dystocia is about 10%. There's definitely breed predispositions to higher rates. So draft horses seem to have a slightly higher rate of dystocia or a difficult delivery. Thoroughbreds more than quarter horses. Also, that's been kind of understood. But in general, in the horse population, it's not as high as we see in a lot of the other domestic species. But if you are a horse owner, you definitely want to be prepared for dystocia, because equine delivery is such a rapid, explosive process, and the horse can really get in trouble sometimes faster than other species can. So even though it's maybe not as high as some of our other domestic animals, it's definitely something that the horse owner needs to consider as something to prepare for when they have a pregnant mare.
Right. So now we're going to talk a little bit more detail, and we will emphasize to the listeners that nothing that is said today here should constitute veterinary advice, and we strongly advise you to contact your veterinarian with any questions that you have. So tell me about the normal progression of a mare having a foal. I mean, it's one of life's little miracles. Yeah. It's beautiful. But just tell me, we should be watching the clock when this is going on. So what are the timings that we need to think about before we start to realize that this mare is having a bit of trouble?
Okay, so good question. So, and I'll just kind of go over some basic things to consider as we talk about the actual delivery process itself. But the mare's gestation is about 340 days, and probably 4 to 6 weeks before she delivers, she may start to develop an udder. So that's a sign that we're getting close to parturition. When the mare develops wax, or those kind of colostrum, looks almost like honey or white at the tip of the teats, then it's thought that she may be within 48 hours. And it's variable among mares, but these are signs that you need to start being prepared for delivery. There are times also, if mares have difficulty in their pregnancy, like an infection or something's gone wrong, where they may develop an udder, start streaming milk way before, and that's a sign that there's a problem, and that can also lead to a dystocia. So when we think about parturition, in the normal mare, she'll go up to the 340 days. The fetus develops in the last 5 days in terms of its maturity for the lungs and all of that. So really the mare and probably the week before she delivers, so there's some very important changes that happen there. The owner may see that the hind end relaxes, that the vulva relaxes, there may be edema on the ventral abdomen. These are all signs that you're getting close to parturition. And then when actually parturition or the delivery, the birth is going to happen, it's broken up as veterinarians, we break it up into 3 stages: stage 1, stage 2, and stage 3. And stage 1 in the mare can be variable, anywhere from 8 to even 24 hours. And this is interesting because the stage 1 labor, if you define it, it's from the mare sort of standing there pregnant, fine, to the uterus starts to undergo some contractions, and the fetus goes in utero from lying on its back with its legs flexed to then flipping over and starting to engage the birth canal. And stage 1 labor is really those contractions of the uterus that we see. The mare may act up, get a little bit colicky. You may see patchy sweat. She starts walking, maybe more. You just notice she may start defecating small piles of manure. And stage 1 labor ends when the chorionic membrane, or the part of the placenta that contacts the cervix, breaks and the fluid comes out, or we call that breaking water. So that stage 1 labor is really the change in the position of the fetus into the appropriate position in the pelvic canal so that it can be delivered. And it's also engaging the cervix in such a way that it causes what's called the Ferguson reflex, where they get more uterine contraction. So as it pushes against the cervix, more uterine contractions are happening and it's pushing harder against the cervix until that membrane ruptures and the allantoic fluid is expelled, or we call that breaking water. It can look yellow, white, sometimes it's blood tinged, it can look variable. Sometimes it looks like urine because really it is kind of fetal urine. And then stage 2 labor happens from the time that you've seen the breaking water to the time that the fetus is passed. And just backtracking for a second, in stage 1, I said it's variable. What I mean by that is the mare can actually stop stage 1 labor if she's stressed. And as a prey animal, this makes sense because if she's in a pasture, she starts to go into labor and all of a sudden she realizes this is not a safe place to foal, she can stop that process. So as mare owners, we may see that in the animal where they start to get worked up and then all of a sudden you call your kids, the neighbors, you got 20 people watching the process and she says, I'm just eating. No, nothing to see here. So that's frustrating for mare owners, but that's where it comes from. So what's important, especially in dystocia, is once stage 1 labor is over and the fluids, the chorioallantosis is ruptured, the fetal fluids come out, you have normal stage 2 is really 20 to 30 minutes. That is the normal window from the time that mare breaks water until the fetus is passed. And in that, the foal exits the birth canal within about 5 minutes. You should see one foot and then a second one or right next to each other, and then the nose just a little bit farther behind with the nose on top.
So for mare owners, because we talked about timing, and I think a stopwatch is important, or at least looking
absolutely.
at your clock, writing that down. So what are when do they need to start keeping track of it? Do they need to keep track of the whole thing, stage 1, or just when that water breaks, stage 2?
The most important timing, because the stage 1 labor can be variable, is when that water breaks. You need to start keeping track of the time because it's going to be really important. If you go along and things are not progressing, by 5-10 minutes, you're not seeing feet, or you only see 1 foot, or you see just a nose, you're going to need to go in and evaluate where that foal's body is in terms of the way it's coming out of the birth canal, where are its legs, and get that set. Because if by 20 minutes you aren't seeing progression or even you've tried to fix it, that's when you really need to think about referral, and maybe even earlier. But we always say, and you guys know as well, if you don't watch that clock, the time in your head may be longer or shorter than you think, and you think you've almost got it, but you may be working for 30 minutes and that foal's life, is really in jeopardy. Just because that stage 2 labor is so explosive. I don't know if you guys, anything you want to add there?
Yeah, no, I think a lot of times we try and relate this too much to what happens in people, right? Where I watched my wife in labor for hours and hours, and that's not a big deal. But it's so different. And you talked about what happens in the last 5 days. That's another critical point where women can have babies much earlier, not a problem. Happens in mares, huge problem. So
yeah. And I remember when I had my first child, I was like, this is what we need to go. And they were like, you can relax. It's okay. But so it's very different. And the reason it's so important in the mare and the equine species is that once the foal starts to come out of the birth canal, the umbilicus is starting to pull the chorioallantois. And so they may start to lose the placenta may start to separate and they may lose oxygen. And so if you have a foal that's halfway out the birth canal, that's starting to have a compromise of oxygen. Whereas in the human, the umbilical cord is attached for longer, a lot of times while it's being passed. So it's just different. And that's why recognizing when you have a problem is so important.
So a normal delivery, I'm not a huge fan of people jumping in and pulling and giving too much help because, like you said, it's an explosive process, and I don't like it to add more powder to that. But what are your thoughts on that? What should people be doing at this point when the mare's having what we would call a normal delivery?
Yeah, so ideally you don't intervene at all. If you can, especially with maiden mares, maiden mares have a higher risk of dystocia, probably partly because they're anxious and just relaxing of the birth canal. But we know that, and anyone who's worked with a lot of foaling mares, the most quiet and relaxed that environment can be, usually the better the foaling goes. And certainly one of the risks of jumping in too early, and pulling is that the foal is constantly having pressure on it, the mare isn't able to relax the vagina and cervix the way she should, and you're more likely to get fractured ribs on the foal, trauma to the cervix. So ideally, you really let the mare do it herself. I think what I would say is once you see the water break, stand back for 5 minutes and just see what happens. Ideally, the mare will lie down, and then you'll see that the white amnion is coming out, covering the 2 feet. Now, if you look and both the feet are there and the nose is starting to come, a lot of times you don't need to assist. But if they're not progressing, so in 10 minutes it's still staying in the same position, or if you see, and we can talk about this as another, not a white amnion covering the feet, but a red surface, that would mean that something is the placenta is separated early, and that actually you do need to intervene.
It's a totally different situation.
Yep, and we can touch on that. But ideally, in a normal foaling, you really, if she's progressing normally, you can let those feet start to come out. You can assist, and what I usually do, we always say you don't use more than the strength of 2 people pulling, and you really just, when the mare pushes, you might just be giving a little bit of traction as she pushes, and then when she relaxes, you let go. Or you can kind of keep it static, because that may help keep the foal in the birth canal.
Yeah, so I think to summarize that nicely, it's like 20 to 30 minutes from the time she breaks the water, that foal should be out.
Yep.
She's not making progress pretty quickly. You got a problem.
Yep.
You've touched on a few things to do and a few things not to do.
Yeah.
What can you actually do to get prepared for a problem in a field situation? Like, you've got a mare that's going to foal. What conversations do you have with your clients? Who are you going to get on the bus? How do you get prepared to actually triage this mare to see, is she having a problem? Apply some very early things to set you up for success. And then if you have to refer. What conversations do you have with your clients right now? What would you like to tell the audience?
Yep. So I would say, and anyone who's kind of worked with any of us, is as soon as the mare is pregnant, you're asking, how are you going to foal out this mare? And I recommend that people, if they've never foaled a mare out, there are many boarding facilities that have really experienced staff that experienced at foaling mares out. So to me, if you are going to foal out a mare, the best place for that mare is with people who are experienced in doing it. If you are going to foal it out at your house, and that is not something you don't have either the option of having the mare go to another facility, is really having a very serious talk with your veterinarian, who is going to be available if something goes wrong. And so first, I would say the best option is to have that mare foal somewhere where it's an experienced foaling staff or person, and also they have the ability to get her to a referral clinic with a horse and trailer, having that ready. Now, like we said, the incidence of dystocia is maybe 10%, but when it goes wrong quickly, and the ability to act quickly is very important. So having a discussion about, do you have an option for trailering this horse? Is there a veterinarian nearby? How nearby? And are they experienced with foaling? Because there are some veterinarians that may not be something that's in their wheelhouse. And so it may also be a team effort. Maybe you're a veterinarian that's less experienced with that, but you may be able to rely on a colleague to be available once you know that mare's getting close, to kind of be on call for that. And then if you are going to be housing the mare with you, or you've had experience with foaling and you just personally want to be set up the best you can for handling a dystocia, the things that we like to discuss is sort of who's on call for that. So if it's going to be the owner foaling out the mare, do you have all the equipment that you need? So usually we like to wrap the mare's tail to keep it clean, having a bucket, rinsing her, cleaning the perineum before she foals. So when you think she's starting to go into foaling, just getting that environment as clean as you can. Also having lube, and some people will recommend we just use sterile lube. There's gallon buckets of sterile lube, so you can have that available if you feel like lubricating the pelvic canal is going to be helpful. And then other things would be, and honestly, this is really something I would feel more comfortable recommending to a veterinarian to have in place, but straps for pulling and stuff like that, because you can actually do some damage to tendons if you put the straps in the wrong place on the foal's legs for pulling. But in a lot of experienced foaling barns, they will have that to help give them some traction, just because it's so lubricated. So I think that covers, I'm not sure if that's what you were thinking of, but...
You mentioned earlier when things seem to start appropriately but don't progress.
Right.
You have the coriolantois ruptures, fluid comes out, feet come about. But what say that doesn't happen? What say you're in a situation where this mare is lying down starting to strain and nothing appears, or alternatively, the wrong sorts of things appear? And you mentioned about a red membrane appearing instead of the foal's feet and a white membrane. So walk us through that. And how would you manage that in the first instance if you were a client with a mare foaling, and things to watch out for in that situation?
Yep, very good. So, probably the red tissue that I'm talking about, a lot of people refer to as a red bag, and basically what it is that instead of the coriolantois, or that membrane that touches the cervix, rupturing and then the fetus coming out in the amnion, the fetus pushes against the cervix and basically brings that membrane with them. So you never, in a true red bag, see them break their water, because the whole placenta is coming out with all of its fluid. Now, the mare may urinate, and there's sometimes where you'll see a little bit of fluid, so it can be a little bit tricky. But the telltale sign of a red bag is, because it's where it contacts the cervix, there's sort of a bald or a different look to the red bubble that's coming out at you, and it'll look sort of red and velvety, and then there'll be a pale area that's in the shape of a star, quote unquote, or it looks sort of like a pale, thinner area. Depending on what's going on, that can be thickened, but that is considered an emergency because the placenta has now changed. The membranes are separated. There's no longer oxygen. The recommendation is to rip that immediately, open as with your hands, so it should appear outside the vulva, and I'll go into why it's important to kind of make these distinctions. But if that comes outside the vulva and you can feel feet behind it, you immediately try to dissect it with your fingers, your hands, or you can use scissors, get to where the amnion is, and then at that point you do want to assist the foal, because this is an emergency. It's losing its blood flow because the placenta is no longer functional, and you're going to try to get that foal out as soon as possible. That being said, there are things that can appear like a red bag. So a red bag is a more common type of dystocia or an emergency in delivery, and it's usually pretty easy to fix if you get on it right away. If you can get the foal out, there may be some hypoxia or compromise, but there are other things, like I said, that can look like that. So one of the things to do if you have a red bag is, if you don't see that star tissue, there's lots, because the mare has had so many hormones that kind of relax everything back there, things can prolapse. So things that pop out that can look like that, the bladder can come out, vaginal parts of the vagina can prolapse. So what you need to do is, they always say that in obstetrics, you want to cleanliness and being gentle and kindness. Those are like the three key obstetrical things to remember. So you want to clean the area, and you want to lubricate it so that you don't tear anything. And then you really want to feel and make sure that what you think you're feeling is right. So in a red bag, you should be able to put your hand all the way around the red bag and feel that it's sort of like a blind sac around that. And that's because this bulge is coming out the cervix. If it's a vaginal prolapse, you will still be able to feel the cervix behind whatever is prolapsed out. So it's just important, if you don't see that characteristic sign of a kind of a star and it's actually protruded all the way out of the vulva, that you make sure that you know what you're dealing with.
You mentioned before about the tissue being thickened, and that is why she's having the red bag. And I'm sure all the listeners are quite concerned about the fact that that red bag means the placenta is detached and the foal is being deprived. So is there anything you can actually do to actually anticipate that may happen?
Yeah, that's a really good question. So I believe that it's important to do at least one late gestational screening of the mare, and that would be with like a transrectal ultrasound. It's very easy to do, and it allows the veterinarian to look at the area of the cervix and where the placenta contacts the cervix. And if there's thickening or some abnormal separation or excessive edema, it allows the veterinarian to say, I suspect there may be an issue here. There may be treatments that may help treat it, but it also allows you at the time of foaling to anticipate a problem. So normally, let's say that membrane should be less than, let's say half a centimeter, okay? If it's 2 inches thick, you're going to have some sort of abnormal separation of that. It may tear somewhere else and it may not be an issue, but it may be a red bag. So in my opinion, it is really helpful. It's not going to catch everything or tell you that every delivery is going to be normal, but in the times when you do have pathology, it may help you initiate treatment that can help the mare in the pregnancy, and also let the people who are going to be foaling the mare, whether it's you or the foaling place that you're taking her to, be prepared for that.
Well, and in all this, I think the important message is have a plan beforehand. Because if you get into a situation where you're not exactly sure what you're seeing, you need to get with somebody who does, and that's where you need to be able to have contact with a veterinarian. Say, hey, I'm here. I'm not positive what I'm seeing. What do I do?
Yep.
Yeah, and I'd agree. Those are all conversations you have to have well in advance. I mean, the 3 a.m. panicked phone call is not going to do anybody any good. And so this is a great opportunity for veterinarians and owners to get together and have a conversation and say, how do we best plan for success? And it's always one of those situations. I mean, you're going to plan a whole lot more for things that'll never happen, but when they do, it can be catastrophic.
Yeah, absolutely.
So you've talked a lot about parturition starting but not progressing. You've talked about abnormal things appearing at the vulva. What other things can sort of go wrong? I mean, can this foal on the way out actually do damage to this mare? And what are the signposts that's occurring? And how do you manage that in the first instance? And really, what drives referral in those cases?
Yeah, so I think that this brings up the point is because there's so many things that cause a dystocia or an abnormal delivery of that foal. So if you break it down, there may be fetal factors, which could either be that the fetus is not viable and can't get itself into position. And one of the things that you will see at delivery for people who are trying to deliver is that the fetus is still on its back, its legs are flexed, it hasn't gotten itself in the right position, and that may be a clue to the person trying to deliver the foal that something's not quite right. Other fetal abnormalities could include skeletal malformation. So if the fetus has one leg that will not extend in the right way, it can do very serious damage to the mare's reproductive tract because it's just not going to come through in that normal window. It may just anatomically, because it's developed incorrectly, not be able to do that. And in that case, what you see a lot of times at delivery is they just don't progress. They might get to a certain point, but you just can't either manipulate the leg, and I'm sure you guys have, you're reaching in and you're trying to get things into position, it's just not going well. And those you would refer, and at that point, you're really trying to salvage the mare's reproductive tract, because sometimes either in the field, you don't have the option all the time of putting the mare on her back and elevating her so that you can get enough room to move things around. And some of these fetuses are not going to come out vaginally. They have to come out either via C-section or other methods, but those would not be ones that you would try to do in the field without an experienced veterinarian.
You've talked about the position of the foal's legs on the way out. What damage can they do if that doesn't go right?
Yeah, so one of the other probably more common things is that if they don't exit the vagina, you may see that one leg is the foal may be in the right position, but they engage the vulva or the birth canal incorrectly. So one leg may come out the rectum. They can tear the rectum, and the foal can get stuck. So most times the mare will push through that, but it can really cause a lot of damage. So being there to witness the foaling is really important, so that you can pull that leg back, push the fetus back into the uterus a little bit, and then get the foal coming out the right way. So the legs can engage incorrectly, the foal can be coming out and have abnormalities that can tear up the vagina and reproductive tract. They can rupture the uterus if they're kicking, or there's lots of different ways they can rupture the uterus, and they can also cause hemorrhage in the mare, which can be life-threatening. So there's a lot of issues for the mare to be giving birth is not a completely safe, and I think in a couple studies they've shown that even mares that came in for assistance with a dystocia, the survival rate can be anywhere from 80 to 90%. So that means 10 to 20% of mares could potentially be lost from a dystocia setting. And that's actually usually because if they've been under anesthesia, they can have, when they try to recover from anesthesia, they can break legs because they're not coordinated, or they can hemorrhage. That's one of the other major things.
Yeah, conversation I have with the interns when we're folding things out in the hospital is having both of those legs coming through at the same time, because often you'll see when they first start, one will be slightly behind the other, but I always like to even them up because it's that one leg back and the elbow over the chest. That's what generates a lot of fractured ribs, and so malpositioning of those legs is quite an issue. So it's pretty obvious from what you've described when these mares are having a problem. You're giving us some great things for people to look out for with their mares. What may they interpret as being a dystocia, but in fact isn't? I mean, what's a condition or a set of conditions that can actually cause people to worry their mare's having dystocia when in fact it's another issue they have to be concerned about?
Sure. So it's a little bit tough, but I mean, mares, any type of colic around the time of when they're delivering, a lot of times people will think that she's delivering, and they may go in as if to deliver, but the cervix hasn't opened and all of that is normal. So one, if your mare is showing signs of discomfort or sweating or agitated, to rule out that it's not a GI upset and not pain associated with those uterine contractions. And one of the best things to do is to call your veterinarian, because they would come out and be able to evaluate her. They could do a transrectal exam and make sure that the cervix is still closed and the fetus is still there, that the fluids haven't been ruptured. And that could be very bad if you interpreted that as something going wrong with your mare. The other thing that a lot of older pregnant mares may do is have blood come out of the vulva that people mistake for something wrong, like the mare's going into labor. And again, that's really great if you can just call your veterinarian, just have them come out. It's usually just a varicose vein right inside the vagina. And obviously you wouldn't have wanted to go in and try to deliver anything because that pregnancy is fine. This is something totally separate. So that would be something. And the other thing, though it's rare for them to have hemorrhage before foaling, some mares will have hemorrhage before they foal. So those signs of colic can be associated with a uterine artery bleed or something like that. And again, you're going to need your veterinarian to come out and check out and see what's going on. So again, I think we all come back to call your veterinarian if you have concerns, because you're so much better being safe than sorry.
So moving on, the mare has had a dystocia in the field. Mm-hmm. With the assistance of their veterinarian, they have actually got the foal out.
Yep.
What do we look at in that mare now? We know that this hasn't been as Mother Nature designed.
Right.
So what are the things we need to look for in that mare over the next few days and going forward to give her the best chance for success reproductively next year, but also have a mare that can adequately look after that foal?
Yep. So a lot of mare, the next step in my mind, first I would just make sure that the mare is stable. So it's really important to me, if she's had a difficult dystocia, that things are quiet. I usually will give some analgesia like Banamine or something to try to keep her comfortable, not stressed, because sometimes if they've had a very bad dystocia, they can still hemorrhage. And so I'm just trying to keep her as quiet and healthy as possible. If the fetal membranes haven't passed yet, that's really your next concern. So your mare is stable, but you want to keep her comfortable, maybe some Banamine, maybe some sedation if she seems really anxious. If she's very anxious after foaling, again, I think that's time to call your veterinarian. She should seem, once she's past the foal, she should calm down. But if she starts trembling, breathing increased breathing, things don't look right, call your veterinarian, because there still are things that can happen after the dystocia. And it's important to monitor her and make sure she's comfortable. But in that immediate period, you'd like to see her quiet, kind of recover, allowing her to bond with the foal. And then I would like to see those fetal membranes pass in a normal amount of time. A lot of times if you've had a dystocia, that takes too long. So some people, I'd like to see them pass 3 to 4 hours after. And if they haven't passed by 2 hours, you may want to start giving some medication to try to help those membranes pass. Because if they're retained past 6, 8, 12 hours, you may run into some other problems, systemic illness because they can get a very bad uterine infection from having those membranes in. So that really, in a lot of mares that have a dystocia, is your next concern. And I would say if they haven't passed in 3-4 hours, to call your veterinarian and ask them what their opinion is, if she's stable enough to try some treatments to try to help facilitate passing, like oxytocin or something like that. But again, you want your mare to be stable, because if you're concerned that the dystocia has been so traumatic that she's at risk for bleed, you may not want to give any of those medications. So it's kind of a double-edged sword. So then in monitoring her, you want to make sure that the membranes have passed. You may need to do a uterine lavage. Certainly keeping track of her heart rate and her rectal temperature will tell you how much pain she's in, as well as how stable she is systemically. So if she's had some trauma to the reproductive tract that you haven't recognized yet, like a uterine tear, a uterine bleed, things like that, they may not show up for a day. And all of a sudden she has an abdomen that has blood in it or something, and she starts to show those signs. So it's really important to keep an eye on her, because she's there now to raise the foal. And from a reproductive evaluation standpoint, I think if she's had a bad dystocia, it's worth evaluating her the next day to make sure you don't have any major tears. They can have vaginal lacerations and things that you might want to put the mare on systemic antibiotics or some sort of treatment to help her clean herself up better. And also the vulva may be torn in such a way that she's aspirating or bringing in a lot of air to her reproductive tract. So really the day after a bad dystocia, if she's quieted down and you're comfortable with her, I would have your veterinarian evaluate her, because there's things that you can miss that can be life-threatening for her. I think, does that cover anything else you can add to that?
I think that's reasonable. I was going to sort of say, if you had your little elevator speech on do's and don'ts with retained membranes.
Yes.
With a mare that's had trouble foaling. So do's and don'ts, you got 10 seconds.
Okay. I would say if she's had a really difficult dystocia, I probably would not give her oxytocin. I would not pull on the membranes really vigorously. I would not put any more weight on them than what they are themselves. And I've seen some people very aggressive with them, and I think the kind of golden rule is just don't pull on the fetal membranes. I think some of us have gotten a little braver, but in a dystocia, you really do risk prolapsing that uterine horn. And doing some other damage. And if you prolapse the uterine horn, you can imagine how far the vessels have to stretch. That's not good. So you really have kind of a very delicate balance after they've foaled, where you just want them to be quiet and take it easy on them. Trying to think of other things. I would not try to get them really excited. So if they've had a difficult foaling and they're very, protective of their foal, having a whole bunch of people around is probably not great. That probably increases anxiety. Pain. I think pain management is really important to allow the mare to come into her milk. And so that she can, if she's really uncomfortable, she's probably not going to have the same milk production as if you can help her out a little bit. I think that's okay. What else would you add to your elevator speech?
I don't know. I just think I got to the top of the Burj Khalifa with that one, but that's okay, because that was good. So I think that's the thing. I mean, just don't pull on the membranes. I think is reasonable, because you mentioned about inverting uterine horn. I've been on the receiving end of those mares, and it can be messy. And I know there's a strong desire to get those membranes out, because Dr. Google says the mare is going to founder. And let's face it, that is a concern. However, I mean, moderation in all things, discretion is a better part of valor. Mother was always right. That there's a balancing act. And this is an ideal time, again, to have a talk to your veterinarian to sort of say, what is the right thing to do here? And it may be in a situation you say, give her some oxytocin, everything's fine. Or the mares you identified, she had a bit of a rough go of it. Mm-hmm. Maybe we shouldn't poke a badger with a spoon, because giving that oxytocin may precipitate something that's a whole lot worse.
Yeah, I made that mistake once with one of my own mares, and it was not pretty. But I think it's important for people to know that it is important to get the placenta out, but managed appropriately. If your veterinarian knows it's there, they can manage that, and they can stay in there for a long time.
That's right.
And be managed just fine. It's not a complete emergency that they get out, but it is important your veterinarian knows that it's there, and can help you make those decisions and provide appropriate treatment.
Yeah, and I think people, are worried about cost, but ultimately look at your investment in that mare and that foal.
Yep.
I mean, everything that you've talked about is trying to give them the best chance to get the best foal possible because they bred it for a reason, and we're looking to preserve that mare to be bred back again. So with this field dystocia situation, what things are you looking at in that mare going forward, medium term, to set her up for success for breeding? And what things might have gone wrong during that dystocia they're going to require a little bit more attention?
Yeah, so a lot of times the uterus in a dystocia just does not kind of snap back into its normal anatomical position, especially if they've had retained fetal membranes or any of those, or if they're stuck in the stall. Let's say the foal is compromised because of the dystocia. So honestly, initially, you're evaluating, make sure there's no tears, lacerations, anything like that. But then the next thing is trying to get that uterus to involute and get the mare feeling better. So you may use uterine lavages, systemic antibiotics. Those are things that will help get that reproductive tract back quicker. And it's interesting, they had in one of the studies where they looked at what's the post-op fertility of mares that had dystocias that came in, 60% of them were in foal that same year. So if you take good care of your mare and you get your veterinarian involved from the time it happened, there are things that veterinarian can do to help improve the uterine health faster and get the mare back on track faster. You have to look for cervical lacerations, and those can kind of be a bummer because you have to let the mare recover. Cervical lacerations, perforations between the vagina and the rectum. These are all things that the tract has been so traumatized you can't repair until it recovers, but it's important to know that it's happened. So if you have feces in the vagina, you need to make sure that there wasn't any trauma dorsally, and sometimes you don't even know that those problems have happened until a few days after the delivery because the tissue is so traumatized that then it breaks down. So having your veterinarian involved from the day after, I think, is really important. And there are other things like putting a Caslix back in if the tissue is, once it's in good enough shape, that really helps stop her from continuing to contaminate herself. So I do think, under the right management, you can get these mares, some of them back pretty quickly. Now, you want to sort of have on your radar as an owner and a vet dealing with a mare post-dystocia. So there may be scar tissue that changes the anatomy. It could cause adhesions in the vagina or make the cervix stick to the floor of the vagina, things that make it harder for that mare to have normal reproductive anatomy. So it's basically any mare that's had a dystocia, I would recommend that your repro vet get involved as soon as possible so that they can really identify if there's issues and help get her cleaned up as fast as possible. And those are issues that are not just important for reproductive health, but they may be important for her systemic health as well, as she has tears and stuff like that. You really need to make sure that she is out of the woods.
You mentioned a torn cervix, or at least a damaged cervix. What time would you like to examine that mare to see whether that was a factor?
Yeah, so usually they'll go through a heat about a week after they foal, and then in the period that follows that, once they've ovulated and they're in diestrus, so within that first month, I would like to look at that cervix and make sure that when the mare's out of heat, it's forming an acceptable barrier. And a lot of times you can pick up the really bad defects, you may be able to pick up earlier, but you're not losing any time because you're not really going to be able to operate on that cervix until 2 or 3 weeks after foaling anyway. But that gives you time after her first ovulation, and you want to look at it in diestrus when she's out of heat because that's when it's forming a barrier to the uterus. So if that barrier isn't adequate because it's been torn or scarred or traumatized from the foaling, you need to know because you can do cervical repairs, and that will help her not only keep herself clean so that she can get in foal, but also carry a foal successfully.
So on the farm, how are you going to examine that cervix? What should owners expect their veterinarian to do? So
that would involve visually looking at the cervix as well as palpating it. So the most important thing really is what you feel, because you can look at a cervix in the vagina with a speculum and it may look normal, but it may have a very large hole in it because the way the folds of the cervix come together, it can hide it. So your veterinarian, to give your veterinarian the opportunity to palpate that cervix is really important and will save you money in the long run, because a mare with a really bad cervical defect that goes undiagnosed can be very expensive because the mares often have a lot of uterine infections and stuff like that. And I'll see those mares as referral cases after they've gone through a whole season of why can't we get this mare clean? And honestly, on speculum exam, they may look very normal, but when you palpate it, there's a big hole or something that's easy to fix. If you'd identified it after foaling, you could have jumped on it and gotten it fixed, and it probably would things would be in better shape.
So going back to dystocias, anything else you'd like to tell people today from your many years of wisdom, which has formed shiny pearls?
I think probably the most important thing is knowing when to ask for help. Don't try to be a hero. And everyone wants to deliver a foal, but there's times I've seen when there's a more experienced person for foaling that's probably the better person. When you get stuck and there's a problem, recognize that there's a problem and get the help that you need. So whether that's referring the mare in or asking the person who you know has more experience than you to check out. If you don't like the way it's going, just remember that foal's life is really in your hands, and the right thing to do is to get the best help you can for that.
And it is an incredible process. The whole birth process is amazing, and these animals are huge, and it happens in horses so fast. Do you ever have to worry about a chicken with a torn cervix?
Well, they have like this amazing Chloe. No, not that I've recognized.
No chicken dystocia problems for you.
But what do you guys, I mean, you guys also have stuff to add to this. What would you say? Like, one of the things I see that goes wrong is people try to be a hero, especially when there's a lot of people watching and things start to go wrong. And either people get too anxious or not anxious enough. And I think keeping that clock of, is it progressing?
Yeah.
Okay, there's no question it's not going right. We're sending it, because if you send it and get out a live foal, no one's going to be upset, right? Or there might be a cost. But if you stay there and try to be a hero and you lose the foal and maybe the mare, because the other thing to remember in these dystocias is they can go on for a long time and then the mare can get paralyzed from being, it can go wrong. So.
No, this is one, we talk about equine emergencies all the time, and this is one of the very few that is actually an emergency when a mare has a dystocia. So I think taking it seriously and making sure things are moving, I think you covered it very well.
Yeah, and you picked up on the thing about time too, is that time just seems to dilate, right? You're in there, you're working, you don't realize how many minutes have passed. And the numbers you talked about are actually very real. I mean, these mares have these foals in 50 to 30 minutes. Yes. They've been doing it a lot longer than we've been messing around. And if they do not progress on that schedule, it is absolutely an emergency, because the foal just doesn't have any time. And you're right, it's not a time to be brave. Everybody's looking at you there to try to solve this problem. But ultimately, this is absolutely a time to call for help. And to Bart's point, this is absolutely one of the true, very time-dependent emergencies in equine medicine. So, again, elevator speech, sum up for your client, one thing that you would tell them if you had the chance, only to tell them one thing. About
just the delivery process?
Yep.
Just be prepared to know what normal and abnormal is and have a plan in place when things start to go wrong or outside of normal, and execute it, follow it up.
Perfect. That was not a pearl, Mariah, that was a diamond. So, well, thank you very, very much for your input today. Hope that has struck a chord with our listeners. And we'll see you next time.
Thanks, Mariah.
Great. Thanks, guys.
Have a great day.